WHO is devoting this year's World Health Day to diabetes. The prevalence of diabetes are alarming and rapidly getting worse. This is a worrying worldwide trend.
In the year 2016, the World Health Organization released its first ever global report on diabetes, and the news was not good. Since the year 1980, the number of people around the world diagnosed with diabetes has increased fourfold. How did this ancient disease suddenly become a 21st century global crisis? To understand the bigger picture, we first need to go back a little in history and understand where it all started. Even though diabetes has been known for 3,000 years in human history, it was a rare disease until 1950. In the 1950s, seemingly healthy Americans developed heart attacks with growing regularity. After some research, dietary fat was falsely believed to increase blood cholesterol levels, leading to heart disease. All the physicians advocated lower fat diets, and this is where the problem began. Restricting fats meant increasing carbohydrates in the patient's diet, as both create a feeling of fullness after a meal. And, in the developed world, these carbohydrates tended to be highly refined. Although the low-fat diet was originally proposed to reduce the risk of heart disease, recent evidence shows no link between cardiovascular disease and total dietary fat consumed. Many high-fat foods, such as avocados, nuts, and olive oil, are now believed to be heart-healthy, while artificially saturated fats, such as trans fats, are universally accepted as toxic. The same does not apply to naturally occurring fats found in meat and dairy products such as butter, cream, and cheese. Without proper scientific evidence, in the year 1980, the United States government came up with dietary guidelines that spawned the infamous food pyramid in all its glory. In this food pyramid, carbohydrates were promoted as a healthy whole grain. The foods that formed the base of the pyramid, foods we were told to eat every single day, included bread, pasta, and potatoes. These are the foods that provoke the greatest rise in blood glucose and insulin. Finally, as a result of this unproven low-fat and high-carbohydrate diet, the rate of obesity cases soon turned upward and has never looked back. In 1980, an estimated 108 million people worldwide suffered with diabetes. By 2016, that number had swelled to 422 million. China, in particular, is a diabetes disaster. In 2015, an estimated 11.6% of Chinese adults had type 2 diabetes, surpassing even the longtime champion, the US, at 11.3%. This number is even more shocking when you consider that only 1% of Chinese had type 2 diabetes in 1980. In a single generation, the diabetes rate has risen by a horrifying 1,160%. The International Diabetes Federation estimates that the worldwide rate of diabetes will reach 1 in every 10 adults by the year 2040. While the world was able to control a lot of diseases in human history, we still can't control diabetes even after 3,000 years of its discovery, because we fundamentally misunderstood the disease called diabetes. There are many types of diabetes, and doctors are trying to treat all of them in the same manner. There are 4 broad categories of diabetes: type 1, type 2, gestational diabetes, and other specific types like genetic defects. Type 2 diabetes is by far the most common, making up an estimated 90% of cases. Gestational diabetes, by definition, is not a chronic disease. Type 1 diabetes is an autoimmune disease, meaning that the body's own immune system damages the cells that release insulin. Insulin is responsible for pushing glucose to each cell in the body from the blood vessels, so our body can have energy to support all of our activities. Over time, the regular destruction of the insulin-producing cells causes type 1 diabetes to progress to severe insulin deficiency. Therefore, the successful treatment is adequate replacement of the missing hormone insulin. The discovery of insulin injections dramatically improved the situation, leading to a widespread feeling that diabetes had been cured. However, the story did not end happily here. Over the long term, type 1 diabetics are at much higher risk of complications, which affect almost all organs of the body and reduce life expectancy by 5 to 8 years compared with healthy patients. Type 2 typically develops gradually over many years and progresses in an orderly manner from normal to full-blown type 2 diabetes. The risk increases with age and obesity. Today, type 2 diabetes accounts for approximately 90–95% of diabetes cases worldwide. The reason behind type 2 diabetes is insulin resistance, where the insulin fails to reduce the glucose levels in the blood. So body tries to overcome this resistance by increasing insulin release to maintain normal blood glucose levels. However, there is a limit on how much insulin the human body can produce. Once this limit is reached, the body can't increase the insulin to reduce glucose levels in the blood, so the patients end up with type 2 diabetes. If you observe, type 2 diabetic patients end up having high insulin levels in their body, which is the exact opposite of type 1 diabetic patients who suffer due to low insulin levels in the body. Curiously, standard drug treatments for the two types are identical. Insulin helps type 1 diabetes because that disease's underlying core problem is a lack of naturally occurring insulin in the body. However, the underlying core problem of type 2 diabetes is insulin resistance, and it remains virtually untreated because there is no clarity on its root cause. As a result, type 2 diabetes ends up damaging the whole body of the patient.